Chapter 8, Stress and Adaptation. I'm going to go ahead and give you a minute to open up your book to Chapter 8. I highly suggest that you do this so that you follow along and you're able to take notes just to kind of see where things are within the book, to make sure that you actually look at the learning outcomes and that you are meeting those learning outcomes. Disclosure: this material does not belong to me and will be used for educational purposes only. What is stress? So, stress is any disturbance in a person's normal balanced state. Everyone experiences stress as part of their daily life, but we each perceive and respond to stress in our own unique way. Failure to adapt to stress has been linked to several physical and mental illnesses. You will encounter many stressful situations in your career. Haha, we're nurses, right? So you must develop healthful ways of responding and adapting. So we said that stress is any disturbance in a person's normal balanced state. A stressor is a stimulus that the person perceives as a challenge or physical or emotional threat. It disturbs the person's sense of well-being by initiating a physical or emotional response. When stress occurs, it produces voluntary and involuntary coping responses aimed at reducing tension, pressure, or emotional strain. The changes that take place as a result of coping are called adaptations. We can also define adaptations as ongoing effort to maintain external and internal equilibrium or homeostasis. Stress is not necessarily bad. It can keep you alert and motivate you to function at a higher performance level. However, if you become too anxious, you may not be able to think clearly or focus on the task. So there's different categories of stress. We have distress, which is actually bad stress, if you want to call it that way. Distress can threaten health. For example, it could be continual financial worries. We have eustress, which is actually good stress. And this is actually, it's protective. Can be stress that actually motivates us. For example, a passionate kiss, or going on the first date, or buying a new house can produce as strong a stress response as a slap in the face. We have developmental stress, which is associated with life stages. For example, college graduation, moving out of your parents' house, getting married. These stressors can be predicted to occur at various stages of a person's life. For example, once again, most young adults face the stress of leaving home and beginning work as an independent adult. And many middle-aged adults must adjust to aging parents and accepting their own physical changes. In a sense, developmental stressors may be easier to cope with because they are gradual and expected, and the person has the time to prepare for them. Categories of stress continue. Situational. Situational stressors are unpredictable. You cannot predict if you will experience an automobile accident, a natural disaster, job conflict, or an illness. Situational stressors can occur at any life stage and can affect infants, children, and adults equally. I want to just emphasize, pay attention to what situational stressors are, okay? Time stressors. Time stressors can lead to angst over the lack of opportunity to tend to all things that you have to do. I can identify with this actually. Common examples of time stress include worrying about managing multiple demands or rushing to avoid being late for work or an appointment. Oh boy, I have to I'm actually worried about being on time today. Anticipatory stress. So, anticipatory stressors are those that you experience concerning the future. Sometimes this stress can be focused on a specific event, such as an upcoming exam or clinical day. Anticipatory stress can also be undefined, such as vague sense of concern about the future or a feeling that sometimes will something go wrong. Physiological stressors. These are stressors that affect the body structure or function. Some more examples of physiological stressors are medications or just chemicals that will affect your body, such as tobacco or environmental toxins. You could also have stressors like colds or trauma. Nutritional deficiencies or high-fat diets will also stress your body out physically. Viruses, bacteria, obesity or sedentary lifestyles. Psychosocial. Psychosocial stressors are external stressors that arise from work, family dynamics, living situation, social relationships, financial strain, and other aspects of our daily lives. The Holmes Raw Social Readjustment Scale contains examples of psychosocial stressors. I want to mention that, just tying this into our nursing care, right? So once again, we are not, as nurses, we're not just dealing with physical problems, right? We're dealing with psychosocial problems as well. If you encounter a patient in your care, in the clinical setting, or just, wherever you're working, and you see that they have problems such as not having adequate living situation, or maybe they just don't have enough food, you want to make sure that you consult case management or the social worker so that this patient can be provided resources to address this psychosocial issue that's going on with them. Okay, clicker check. The hospitalized client states, I need to know when I'm going to be discharged. I'm so upset and worried that I'm missing work. The nurse knows. I'm going to go ahead and give you some time to read those answers. You can actually pause the recording. The correct answer is going to be D. This is an example of distress and could affect the client's health status. The client's statement indicates that they are experiencing distress, even though it could be termed psychological stress. It would be inappropriate to simply place the client on antidepressant therapy without gathering more data. You always want to make sure that you gather more data on your patients to see what's causing or what's going on, okay, with them, right? Coping strategies. So what are coping strategies? So these are going to be thinking processes and behaviors a person uses to manage stressors. So coping strategies can be divided into adaptive and maladaptive. Adaptive are going to be your healthy, good coping strategies. They consist of making healthy choices that reduce the negative effect of stress. For example, exercising to relieve tension, hobbies, seeking support or advice. On the other hand, we have maladaptive coping strategies. These do not promote adaptation. Unhelpful coping choices include overeating, working too much, oversleeping, and substance abuse. Although a maladaptive behavior may temporarily relieve anxiety, it may have other harmful effects. For example, a person who uses tobacco to relieve tension of a stressful work situation may experience an immediate decrease in anxiety, but with long-term risks to health, such as cardiorespiratory diseases. Dealing with stress. People use three approaches to cope with stress at different times and in various combinations. One of them can be altering the stressor, such as in some situations, a person takes actions to remove or change the stressor, like changing jobs. A second one can be adapting to the stressor. It is not always possible to remove or change the stressor, like we mentioned, like changing the jobs. So adapting involves changing one's thoughts or behaviors related to the stressors. For example, changing your thoughts about nursing clinicals, right? You can't get out of your nursing clinicals. You can't, for example, get out of a clinical site. So this would be just changing your thoughts about the negativity that you have about nursing clinicals. Number 3 would be avoiding the stressor. This is just altogether, for example, ending a relationship or avoiding a certain person that causes you stress. You can find out more about this in page 212 of chapter 8. Successful adaptation allows for normal growth and development and effective responses to changes and challenges in daily life. The outcome depends on the balance between the strength of the stressors and the effectiveness of the person's coping methods. Even with a positive attitude and good coping skills, excessive amounts of stress can lead to maladaptation and disease. Some people succumb to illness after experiencing only a few stressors, whereas others seem to adapt to multiple, intensely difficult stressors. Each person has a different ability to tolerate stress, but everyone has a breaking point at which stress becomes overwhelming. So the ability to adapt depends once again on the intensity of a stressor, the effectiveness of coping skills that the person has, and the personal factors. Personal perception of stressors. A person's perception may be realistic or exaggerated. Suppose two patients with similar coping skills and support systems both must have a mastectomy. One thinks, yes, I'm losing a part of my body, but I'm more than just my breast. I'm so grateful just to be alive. The other feels, oh, I will be so ugly. I feel less of a person now. Which patient do you think is more likely to adapt successfully to this change in their body? Overall health status. Stressors may actually cause a healthy person to engage in constructive, adaptive behaviors that improve health. A person who has just discovered that they have hypertension may react by modifying their diet and exercising to lower their blood pressure and prevent complications. On the other hand, if a person with hypertension also has been coping for years with the pain and immobility from arthritis, they may be too overwhelmed and exhausted to take any actions to lower their blood pressure. Okay, continuing with factors that influence adaptation. A good support system can help a person adapt to stress, provide emotional support, encourage expressions of feelings, and help the person solve problems. It may also provide financial and other concrete types of support, such as a place to live, meal preparation, household help, childcare, and transportation. Hardiness. People who thrive despite overwhelming stressors tend to have a quality that has been termed hardiness. They maintain 3 key attitudes that help them weather adversity: commitment, control, and challenge. Commitment lets them seek to be involved with ongoing events rather than feeling isolated. Control enables them to struggle and try to influence outcomes instead of becoming passive and feeling powerless. Challenge allows them to perceive stressful changes as opportunities for learning. Personal factors that will also influence adaptation will be age, developmental level, and life experiences. Okay, so the physical responses to stress. We have the general adaptation syndrome. This one is going to have 3 stages. The first one is going to be the alarm stage. The second is going to be the resistance adaptation. And the third and final stage is either recovery or exhaustion. The general adaptation syndrome is taken from Selge's theoretical model of physiological responses to stress. And it states that nonspecific bodily responses are shared by all people. And these responses can be to distress as well as eustress. And as I mentioned, it involves 3 stages. The first stage, the alarm stage, this is going to be or fight or flight. It involves involuntary body responses from the endocrine system, from the sympathetic nervous system by releasing epinephrine and norepinephrine. So, has someone ever playfully grabbed you from behind and shouted, "Boo"? How did you feel? If you are not feeling a response to that, think back to a time when something else startled you. Did your heart pound? Did you breathe fast? Was there a flutter in your stomach? Did your muscles tighten? What were your emotions? Did you want to run away or were you frozen? That exercise in imagination should help you understand and experience the alarm stage. When the patient first presents in this stage, you are going to see them with a rapid heart rate, elevated blood pressure, and rapid respirations. So once again, in the cardiovascular system, you're going to see vasoconstriction, like I mentioned, elevated blood pressure. The respiratory system, your bronchioles are going to be dilated. In the metabolic system, you're going to have an increased metabolism, increased availability of glucose. The urinary system, you're going to see sodium and water retention. And the gastrointestinal system, you're going to see decreased peristalsis. And in the musculoskeletal system, you're going to see increased blood flow to the muscles. Socratic reasoning. In your own experience, based on the general adaptation syndrome, how does a high level of stress affect your mind, body, and spirit? How does Hans Selge's general adaptation influence how you might approach caring for your patient who is under a great deal of stress? Think about that. Okay, so continuing with the stages. In the resistance stage, this is going to be stage number 2, the body tries to cope, protect itself against the stressor, and maintain homeostasis. Stabilization involves the use of physiological and psychological coping mechanisms. If stress is too great, as in a serious illness or severe blood loss, defense mechanisms fail and the person enters the 3rd phase of the general adaptation syndrome, which is either exhaustion or recovery. If adaptive mechanisms fail, and they become ineffective or non-existent, then they enter the exhaustion phase. We can see a person entering this stage if, for example, their blood pressure decreases, they have an elevated pulse and respiration. This usually ends in disease or death. So once again, this could be, for example, a patient that's been fighting, that's been like on the ventilator, and then they take a turn. We begin to see a blood pressure decrease, an elevated pulse, elevated respirations. This is usually not good. So you want to remember this exhaustion phase and what signs or vital signs and symptoms are associated with it. If the adaptation is successful, then we can talk about recovery. This is when obviously a person has been fighting for 1 week or 2 weeks an illness, and then they suddenly become to get better, right? Clicker check. A client who is taking the drug atenolol may not exhibit the expected rise in blood pressure and pulse during the alarm stage of the general adaptation syndrome. True or false? First of all, you want to see what atenolol is and then go from there. And the answer is A. This is going to be true. Atenolol is classified as a beta-blocking agent. By preventing epinephrine from binding to beta receptors, this drug would mask or lessen the cardiovascular response during the alarm phase or alarm stage. Right, so we have physical responses to stressors, the local adaptation syndrome, whereas the general adaptation syndrome is a whole body response to a stressor. The local adaptation syndrome is a localized body response. That is, it involves only a specific body part, tissue, or organ. It is a short-term attempt to restore homeostasis. The two most common local adaptation syndromes that you will deal with as a nurse are the reflex pain response and the inflammatory response. Others include blood clotting and pupil constrictions in response to light. The inflammatory process. The inflammatory response is a local reaction to cell injury, either by pathogens or by physical, chemical, or other agents. Regardless of the injuring agent, its mechanisms are the same, and they produce the classic symptoms of inflammation, which are pain, heat, swelling, redness, and loss of function. The inflammatory process includes a vascular response, a cellular response, formation of exudate, and healing. Physiological responses to stress. These include feeling, thoughts, and behaviors that gives us anxiety and fear. We begin to cope with ego defense mechanisms such as denial, projection, and rationalization. Stress also gives us anger or depression. Consequences of failed adaptation. Continual stress is a result of repeated central nervous system stimulation and elevation of certain hormones. Continual stress brings about long-term changes in various body systems. People who have maladaptive coping strategies such as overeating or substance abuse create additional stress on the body, further contributing to disease. Areas to assess include stressors, risk factors, and coping and adaptation. Data about the patient's stressors and risk factors should help you to determine whether the client has a realistic or an exaggerated perception of the stressors. Identify factors that increase risk for future stress. Identify interventions to reduce current stress and to provide anticipatory guidance to prevent future stress. The response to stress response are holistic. Therefore, you will need to assess physiological, emotional, behavioral, and cognitive indicators of stress. In the support system, recall that the support systems such as family, friends, and coworkers are important to the success of the client's coping strategies. Conversely, these people may be affected by the same stressors or by the client's responses to them. Stress-reducing interventions. Health promotion activities such as adequate nutrition is essential to maintain the integrity of the immune system, and proteins are needed for tissue building and healing. In addition, overweight and malnutrition are stressors that may lead to illness. Regular exercise promotes physical homeostasis by improving muscle tone and controlling weight. Sleep and rest restore energy levels, and it allows the body to repair itself and promote mental relaxation. Encourage the participation in leisure activities. Help clients to manage time, balance responsibilities, and prioritize tasks. Advise clients to avoid maladaptive behaviors such as excess alcohol, caffeine, sweets, smoking, and illicit drugs. Use of specific interventions to relieve anxiety. Anger management. And stress management techniques such as meditation, humor, yoga, and change perception of self. Clicker check. The nurse should assess every client to determine if stress reduction interventions should be part of the plan of care. The rationale for this action is that, take a moment to look at the choices. The correct answer is C. The occurrence of stress in clients is unpredictable. The nurse recognizes that all clients respond differently to healthcare interventions. Therefore, it is important to assess every client's level of stress to determine if interventions are required. All right, this is going to be all for this PowerPoint. I will see you in class tomorrow.